My name is Dr. Keith Kakame. I'm a medical officer currently working with Mulago Hospital. I'm a public health specialist as well. Cancer is a common disease that is caused by abnormal cell growth. Usually what happens is that cells have a controlled growth, whereby one cell will multiply to produce 2 cells, then 4, then 8, then 16. So there are certain signals that are protein in nature that control the reproduction or cell division process. Now when you have cancer, it means that your cell division has gone out of hand. Cells are multiplying, dividing at a rapid rate without control. So in the process you develop a tumor, and then the tumor can spread from one place to another, and that's when it becomes a malignant tumor, which is known as cancer. If it does not spread and stays in one place, we call that a benign tumor. So cancer has been here for quite a while, but its incidence or the number of new cases are actually increasing. In Uganda, the commonest cancer in women is cervical cancer and breast cancer, whereas in men, it's small prostate cancer, colorectal cancer. Yeah, it's true that there's a link between diet and cancer. Observational studies have shown that certain foods increase your chances of getting cancer, and certain foods reduce your chances of getting cancer, and certain foods may help you cope better with cancer. Generally, cancer is mainly caused by, there are certain risk factors that increase your chances of getting cancer. Some you have control over, others you don't have control over. For example, some of the factors that you may not have control over include genetics. There are people who are genetically predisposed to getting certain cancers, like breast cancer. There are also infections that put you at an increased risk of getting cancer. For example, we know that certain cancers like Kaposi sarcoma are more common in HIV positive patients. Hepatocellular carcinoma is more common in patients with hepatitis B and C. And so these you may have infections, you may have other risk factors like smoking. Now, diet is also, it can be a protective factor, or it can be a risk factor. So, starting from the positive side, we well know that cancer, like I told you, it's a process whereby cells rapidly multiply and move from the primary site to other parts of the body through either the bloodstream or lymph. So when you're preparing for a run, usually the same nutrients that you should be taking, you continue taking them in a balanced manner, and that includes proteins, carbohydrates, vitamins, and minerals. Now, what changes is that when you come to running will use up more calories than you've probably been using, but usually it's for 1 hour or 2, or at most 3 hours. So what I would recommend is more of exercising, so that your body gets used to, your muscles get used to flexing, to contracting, in preparation for the run. Now, when it comes to diet, we recommend that you cut out the fatty portions. You eat less fried food, eat less of fried meat, and yeah, fried food, fried fat, putting margarine on bread, and other things that we know contain a lot of fat. When you take in more of protein, it will help in building your muscle before and even after the exercise. This also should be done together with lots of water. It's recommended that you take in 6 to 8 glasses of water on a daily basis.